and so I'm not sure if you can put it.
Trish, are we ready?
I can try.
Okay.
You're gonna drive? Okay.
Good morning and welcome to the County Commission meeting of May 6, 2025. I call this meeting to order and will note for the record a quorum of members present with Commissioner Karski and Benninga absent. Before we get started, I'd like to remind everyone to silence their cell phones, and if you plan to speak, please sign in at the back of the room. Please rise for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. That brings us to our routine business. Looking for a motion to approve the agenda.
So moved.
Second.
Motion and a second. All those in favor?
Aye.
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 Motion carries. And moving on to the consent agenda. The consent agenda is routine items that the public has the ability to comment on or commissioners can comment on. Is there anyone from the public who would like to comment on the consent agenda? Any commissioners' comments? Seeing none, I need a motion to approve the consent agenda.
So moved.
Second.
Motion and a second. Roll call vote, please.
Kipley,
Aye.
Heisey,
Aye.
Blyenberg.
Aye. Motion carries. Moving on to regular business, that brings us to a public hearing to consider special event malt beverage and on-sale wine retailer's license for Siouxland Renaissance Association at W.H. Lyon Fairgrounds on June 7th and 8th, 2025. Kim Christensen, Commission Recorder.
Good morning, Commissioners. Kim Christensen with the Auditor's Office. We have received an application for a special event on sale wine retailer's license and special event malt beverage retailer's license from the Siouxland Renaissance Association. The Renaissance Festival will be held on June 7th and 8th at the W.H. Lyon Fairgrounds. These licenses will allow the organization to sell wine and malt beverages to be consumed on site. The application was reviewed by the Sheriff's Department, State's Attorney's Office, and Planning Department, and there were no objections or concerns reported. The fee is for each license is $50 per day plus a publishing fee.
Thank you, Kim. As this is a public hearing, we'll hear from any proponents. Anyone opposed? Any opponents? Seeing none, I'll open it up to commission discussion or a motion.
Madam Chair, my only question would be if they have good meat at the event or not. I'll make a motion to approve the license for the Siouxland Renaissance Association.
Second.
Motion and a second. Roll call vote, please.
Heisey,
Aye.
Kipley,
Aye.
Blyenberg.
Aye. Motion carries. Item number 9 on the agenda, consider a motion to approve or deny the 2025-2026 malt beverage and South Dakota farm wine license renewal applications. Kim Christensen.
Good morning, Kim Christensen, the Auditor's Office. We have received the first set of renewal applications for the 25-26 licensing period for malt beverage and SD Farm wine license applications. Each entity has submitted the proper application and license renewal fees to our office. Upon review by the State's Attorney, Planning, and Sheriff's Offices, no questions or concerns were raised on these applications. The renewal fees for each entity is $300, of which $150 is readmitted back to the state of South Dakota, Department of Revenue, and the remaining $150 stays with the county. There's no limit on the number of licenses that we are allowed under this, and the current licenses expire at the end of June. So this is a mid-year license renewal as compared to a calendar year.
Thank you. Any public comment on this item? Commission?
I'll make a motion to approve.
Second.
A motion and a second. Roll call vote, please.
Kipley,
Aye.
Heisey,
Aye.
Blyenberg.
Aye. Motion carries. Next on the agenda is the Board of Mental Illness Annual Presentation with Tom Weirheim and Aaron Johnson. Good morning.
Morning. Tom Weirheim.
And Aaron Johnson, we're from the Board of Mental Illness.
And we just, this, our annual presentation, it's going to be budget time. We kind of walk through what we've been seeing with our trends. And I'm going to have Aaron first kind of walk you through our process, and then I'll go through kind of what we're seeing.
We have a couple new commissioners, so we thought we would do go back to kind of our basic role as co-chair. I'm not sure how we go to the next slide.
You can scroll yourself. Or?
No, if she could just scroll for us, that'd be great. Okay. Be the next page. There we go. So a lot of I want to talk a little bit about how our process and then how that affects our budget. We see a lot of mental illness holds come from law enforcement, and so when a law enforcement officer places a hold, they read the person the rights, they place that person into custody, and typically that person would be taken to behavioral health or an emergency room in the area. And then one of the QMHPs from the Board of Mental Illness would see that individual and evaluate. And if you could scroll down just a little bit, that person would talk to the patient, get some information about what was going on, and talk to family members and friends. Those QMHPs, qualified mental health professionals, are paid by the county, and so the number of holds and the number of people that those individuals see also affect our budget. The results of that evaluation then determines whether the hold is continued or released. And so we, as co-chairs, would talk to the QMHP and gain some information about the individual and what happened. And then we would either release or continue the hold. And so that person then would either remain in the hospital or be released. And those hospital days then affect our budget. So if that hold is continued, then that money comes out of the budget for the Board of Mental Illness. So each day then the QMHP would reevaluate these individuals, and whether the hold is continued or released, we visit with the QMHP. The QMHP may get some additional information. If they continue to meet criteria for a mental illness hold, then we keep the person in custody. We do hearings every 5, 6, and 7 days. And so we do hearings on Tuesdays and Fridays. We can hold someone 5, 6, or 7 days. 5 days, 6 days if there's a weekend, and then 7 days if there's a weekend and a holiday. So we attribute, I guess our budget is a little bit less than it has in the past. And so we attribute that to people having insurance. More people have Medicaid or insurance. And so we've reduced costs in that way.
Yeah, so if we scroll up to to that initial table there I had, that's kind of the trend we've seen as far as the increase. Typically, we see an 8 to 10% increase every year in number of holds, kind of commensurate with the population increase in Sioux Falls. So we've had that increase. That the number for 2025, that is a little deceiving. That's through March. April is usually our busiest month, so we'll kind of get a better idea where we're going for the year here after we get April entered in our database, and then we see what happens here through May. But when you see the number of holds per day, we've got about 4.5 holds a day, and that includes doing that on Saturdays, Sundays, and holidays. And those QMHPs see all those new holds, and then everybody that's still on a hold from the day before, so that can compound. And so that's things we need to consider. What we've also started to track is the number of days per hold, because anecdotally we feel like some of the people on holds, the situation has gotten more severe. And so we've kept people, we think, probably a little longer to get their meds adjusted and get them stabilized. And so we've been watching that, and over the last year and a half, we've had that entered in our database too, to kind of watch that. And it's been about a day and a half per hold that people have been on until we've decided to dismiss. We're kind of watching that number to see if that changes, to see just how severe things are and if that corresponds to what we are seeing anecdotally. Yeah, and as Aaron said, as our holds have gone up, our budget has still stabilized. We like to think that's because we're better at our jobs than what we used to be, but I think most of that is attributable to that Medicaid expansion and to more people having insurance. Right? Any questions?
First, we'll open it up to public comment. If there's anyone from the public who wants to comment. Any questions, any comments from the commission?
Madam Chair, I'd lead us off with just thank you guys. Thanks for being color coordinated today. You guys look good. Explain to me how tough it is to get qualified mental health professionals, just from a staffing perspective in our communities. That can be a challenge, but are you guys seeing quick response time and good meeting your needs, or can you just describe the state of that workforce from your perspective?
The QMHPs that we have are very good at what they do. The QMHPs that we use for the board typically have a full-time job or another job, and then do this in addition to their other job. So one of our QMHPs works in assessment at Avera, and then works for the board Monday through Wednesday. Another one of our QMHPs has a private practice, and she's a therapist. And then she works Thursday and Friday for us. And then we have another individual who has worked for the board for many years, and she covers some weekends, usually I think 1 or 2 weekends a month. And the other 2 rotate. So we've got 3 that rotate weekends. And then we have a couple additional QMHPs who are on kind of a PRN basis. So they will fill in if, let's say we have a lot of holds one morning and someone needs to be seen at the jail and the VA and at Sanford. One of those individuals would go out to the off-site areas to visit with people. So it's a different type of position. So it's difficult to find individuals to cover that. But the people that we have found are good at what they do, and it works for them. So we appreciate them.
And they've been in the role for a while now, so they've got a lot of experience. The biggest issue we deal with is just the travel from place to place. When we've got somebody who's on a hold, we've got several at behavioral health, then we've got one at each hospital and somebody at JDC or the VA. There's a lot of travel involved, and so that's when they bring in a PRN individual to kind of help out, because it's just too much to commute all over and still see everybody in a single day.
Madam Chair, my one other question would just be, can you paint a picture for us, just the demographics of the folks getting this assessment? Young, old, probably every age group, male, female, all those different demographics. I'm sure you see a little bit of everything, but is there anything that jumps out at you? For example, I know that the city is looking at adolescent mental health, and are you seeing over your time, are you seeing that age group pop up a little bit more, or some of the groups in South Dakota looking at suicide awareness are seeing more suicides from middle-aged men? So just different demographics, and where are you seeing at it from your perspective in the mental health ecosystem?
I think we see all ages, all income levels. We see a variety. However, we have seen an increase in adolescent holds. Typically, kids will come in and if they've been placed on a hold, a lot of times a parent or guardian will sign them in. So those holds don't typically last long. A lot of times it's transportation, and they need to get the minor there to Avera Behavioral Health or to the hospital. But then typically those holds would be released in favor of or as voluntary when they're signed in by a parent or guardian.
Thank you.
I just had a question also. The statistics that you've provided, are those unique holds or are they visits?
Those could be the same individual, yes.
Okay.
So that's just a number of holds, somebody we may have released because they were stable a month ago or whatever that showed up again. That's not unique individuals.
And just anecdotally, does that make up a big percentage of what you do, or?
As far as people that are in more than once,
I mean, there are some individuals that we see more often than others. Sometimes, we'll see, or the QMHP will evaluate somebody who has never been on a hold before, and we're not familiar with that person. Sometimes that would take a little bit longer. I think the evaluation would take a little bit longer. They have to gain more information. If the QMHP is familiar with the person, they may not have to spend quite as long gaining background information and things like that. But there are some people that we see on a regular basis.
And when your time with that patient is ended, are you making referrals? And how does that process go for you? And with sharing of information, is that a hurdle, or does it work well with your partners?
We don't have direct contact with the patients, but the QMHPs are the ones that have direct contact with the patients. And they would typically sometimes they work with social work at Avera Behavioral Health to, connect the person with resources in the area, things like that. Avera social work has been good to help connect those patients, though.
Okay, thank you.
Thank you.
Madam Chair, I understand there's been an increase in mental health issues post-COVID. Have you seen much of a change in the nature or severity of mental issues? And it looked like the numbers also reflect that over the last number of years. And is there any speculation of what that could be attributed to?
Maybe I'll let Tom answer that.
well, so much like the general crime statistics from when COVID first started, we had that first 2 months, our holds dropped off a cliff. We think it was probably because everyone was probably, in the company of somebody else in a safe place, had some support. Once things started to kind of open back up, we saw those holds kind of come back and basically just pile back up from there. But from there, I think some of it is awareness, but I think also it's just a general increase in our population here as well. That goes along with the increase in the mental illness holds. So,
Thank you.
Well, thank you. Thanks for being here and for the work that you do.
well,
Thank you.
That brings us to item number 11. Consider a motion to authorize the Minnehaha County Sheriff's Office to apply for the Walmart Community Grant Program. Maria Monkvold, Emergency Management Assistant Director.
Good morning, Commissioners. Excuse me. Thanks for having me. My name is Maria Monkvold. I'm here with Minnehaha County Emergency Management and the Sheriff's Office, and I'm here requesting to authorize the Minnehaha County Sheriff's Office to submit an application for the Walmart Community Grant Program. For the past several years, the Minnehaha County Sheriff's Office Community Engagement Committee has hosted several events where our Sheriff's Office staff has interacted and engaged with the residents of the community we serve. One of these events is called Christmas with Deputies, where we spread joy and goodwill to families in need during the holiday season. Our team of deputies and correctional officers take children shopping at Walmart. They provide families with fresh groceries, and a warm meal is served while fun family activities are offered with their families and ours. In order for a community engagement committee events like this to occur, partnerships and donations are graciously welcome in order to offset the costs associated with the numerous needs of the communities and ensure the sustainability of future events. The Walmart Community Grant Program is an opportunity for our agency to receive financial support that will be directly applied to our community events. The one-time award can range anywhere from $250 to $5,000 for eligible applicants who outline their plan to support public safety programs and improve the quality of life for the citizens they serve. Any funds received would be managed within our existing donations account through the county financial system, Munis. Our agency applied for funding through the grant last year and was graciously awarded $2,500, all which was used for the Christmas Deputies event. Thank you for your consideration, and I'm open to any questions.
Any public comment on this item? Commission?
I'll make a motion to approve.
Motion and a second. Roll call vote, please.
Kipley,
Aye.
Heisey,
Aye.
Blindberg.
Aye. Motion carries. Thank you. That brings us to the Human Services Annual Presentation. Carrie Benz, Human Services Director.
All right, good morning, Commission.
Good morning.
Carrie Benz with Human Services Department, and I'm accompanied this morning by Lori Montes, who's our Assistant Director. I thought it would be a nice change. Instead of just my mug standing up here, it would be nice to have Lori join me as well. There's always a lot to cover when we're trying to prepare for another year's budget. And so we've spent a little bit of time really looking at a number of components, primarily because we really haven't had just a county-dependent budget for about 5 years. And so we've taken a lot of time in looking at the time we spend administering One Sioux Falls. We've had ARPA funding, South Dakota Cares that we participated in helping disperse. And then we've also had some grant funding that paid for one of our positions for a portion, just about a full year. And so we really wanted to try to build a flexible budget, one that can accommodate the changing and ever-evolving needs in the community. But we also really wanted to look at the priorities that we needed to set forth and really prepare so that we're ready for 2026. We know that it's going to provide us with some extra challenge, just as it is the Commission, when looking at the challenging issues that we face. So Lori's just going to start out with highlighting some of our efficiencies that's being implemented starting out this year, bleeding into 2026. And then I'll just follow up with some initiatives and some other things that may challenge us for the budget.
All right, so in the memo, there are quite a few listed, and I wanted to just highlight maybe a few of those things that we have going on in our department that really have been, I think, helping us to streamline and make programming more efficient. So one of those is cross-training of our department staff. So that's something that we've done kind of informally for quite some time. Last year, however, we really put more effort, concerted effort into an organized kind of shadowing experience for our staff so that they really could learn at least fairly in depth. I don't know if they could all step in and do each other's job necessarily, but at least they could help in times of shortage. Each of our teams is 4 staff members. And so you can imagine when there's vacations or people out for illness or at a training, that kind of thing, some of the teams can get kind of small. And so we'd like to be able to have other staff step in to help with coverage in those situations. And we've really noticed that kind of just recently. Now we've had a couple staff resignations, and so they were from the same team, and so that limited us to 2 in our emergency relief program. And so it's been just a great bonus to us to have other staff be able to step up and help process those emergency relief applications for assistance with rent and utilities and that kind of thing. So that has definitely proved fruitful. Another emphasis we have had is working on professional development for our team. And so we really started that in the end of 2023. We had a consultant come in and really share with staff kind of the idea of a professional development plan, which is something we've been really excited about because something that, I don't think most people in our department have had the opportunity to do, and it really allows them to focus on where do they want to grow professionally and how can we help in that process. And so rather than just doing trainings here or there, it's really putting more of a combined effort into looking at that individual and what their training needs are and their interests are, and trying to help them grow in their position, and hopefully in the process getting them to stick around. So hopefully helping with staff retention as well as staff growth there. Another kind of efficiency that we've implemented is actually, you can see in the picture there, sort of, is took a look at all of our collaborative meetings. So that list is internal meetings, external meetings, things we do in partnership with all of our community partners, as well as sitting on boards and on committees, just to make sure that we can help where needed. We can provide maybe some kind of organized information and a way for people to connect. I think one of the things that we hear quite often is that our community kind of operates in silos sometimes and that we're not real collaborative. And I would say that this shows you that just the opposite is really the case, that we really do work very closely with all of our partners. And so in this effort, most recently, we've really looked at, do we have the right people at the right meeting that are sitting at that table? And so we've come up with a couple different meetings now that we facilitated with our external partners that will look at hopefully handing off to other nonprofit agencies to lead that effort. We'll still have somebody representative at the table to kind of keep our pulse on what's happening in our community, but having somebody else take leadership of that, which is obviously fabulous and something we really do strive for. And then the other one that I wanted to highlight is the Just Home program. And so I think you guys have heard some about that. That's been an effort for the past 3 years, kind of a demonstration project in trying to get those who are justice impacted into housing as well as supportive services. I think just in the last year is really when we've really moved people from that population into some housing that's been successful. And we're currently in process of transitioning kind of oversight of that program to a couple local partners. And so that too will give us a chance to, we'll stay involved, I'm sure, and be a resource for them, but allow other folks to step up and help with that process for those justice impacted folks.
All right, thanks, Lori. So I just wanted to come forward and in preparing and looking at the 2026 budget, really looking at some of the goals, projects, and initiatives that we really wanted to move forward for 26. Advancing that professional growth, as Lori talked about, we are expanding on that development. And with that professional development, it really does boost the departmental success. And it also really improves the trajectories for those that we're working with, much like number 2 that identifies the staff skill set and expanding and attending some of the Think 3D trainings that I know have been involved greatly at the jail and throughout our community, including the prison system. With our jail reentry crew, they are attending that LOT program, and much to I guess it's not really to our surprise, but I think what we've really learned out of that is that through that similar language and using the same verbal cues to people, we can then utilize that same language when we have them as clients and continue to help them in their growth and their trajectory changes because we're supporting them just as they had to learn in going through that same LOT program. So we have 4 staff right now that are attending that as well. In with those that are justice impacted. So it's a great way to learn from one another, with one another, and hopefully then embrace how we can move forward together as well. We're also working on the development with the city on the Housing Hub, which is actually going to be a digital format for people to be able to access, primarily case management staff, to look at where there is availability in regards to apartments, units that are affordable, safe, and those places that we can rapidly rehouse people. Homelessness is incredibly expensive and impactful to our budget, and so it really does expedite getting people rehoused, reconnected, and reestablished. The recruiting additional vendors to our list. The county has a laundry list of vendors that are accessed and work with us. However, we also know that as time changes and evolves, some drop off. They maybe sell their properties. They collaborate with someone else and they've combined those resources. And so for us, it really is about trying to recruit and have kind of that never-ending growing and in perpetuity changing list of resources so that as the needs of our community evolve, so does our list of options to assist them. When we look at exploring opportunities to further support households, we want to implement some prevention strategies. we really do try to get on the front end of the bus. And when I say that, I think sometimes it's easy to sit back and we look at others to try to drive the bus and we're just along for the ride, right? Our idea is that we need to be at the front of the bus. We need to help drive the bus and be able to look at resources, expand what services are provided, and really help align our community. And much of that has been through our project with Heart of Service, which ended up being a grant that the Sioux Falls Area Community Foundation provided us as an opportunity to pull together our community. We are working on same language, same approach, having that mindset, the professionalism that we need to all work together to best serve our community. So it really is looking at how do we put into work those prevention strategies that optimizes services and changes trajectories for those that we work with. We're going to complete some time studies to really look at what our task assignments need to be and who needs to be doing those tasks. As we've had people retire out of our department, our department has shifted kind of in the layout of how we do service. And so we really do want to look at some of those assignments and try to streamline as much as we can, accessing people's skill sets and really utilizing their time and efforts to do the best that we can. And then we also want to explore some grant opportunities for Safe Home. They do a lot of great groups at Safe Home, trying to help with education, trying to get people on the right track in regards to recovery. And that takes time, it takes effort, and most often anything that's associated with that, staff are awfully great at pitching in their own funds to provide some resources and things, which is terrific. But it's costly. So we really do want to look at how do we expand that opportunity for that group that oftentimes goes unnoticed, forgotten. They can learn, they do learn, and they actually do incredibly well. And those groups have been incredibly well received by that team. So I'm going to just close with the potential impacts that we look at for our budget for 2026. If you can just scroll down to the next slide there. We'll go into the potential impacts. So as we all know, with the federal changes that have come into play in the last number of months, there's a culmination of those federally funded assistance programs there's many that will be coming to a close. We know that many of our partners have been impacted by the decline in the number of grant funds that are being allotted. And so we know that in that, we're going to probably need to be stepping up to bat more often than not. So we know that that will be an impact for sure. Unknowns related to potential changes in the Medicaid eligibility. And I know that we've all looked at our budgets, looked at how we can make some cuts. One of the real positives for us is that with the expansion of Medicaid, we've been able to minimize the impact on our budget because many people now have that insurance. With some changes that are potentially out there, we're not real sure what that will mean for us. However, we do know that when we look at past funding in that line item, we've been looking at $500,000 a year. With the resolution of many of past claims and our staff really putting in a ton of time of finding resolution to some of those, including Mike Thompson. I really do want to recognize him. He's an attorney that we have funded through the SAO. He has been our coach through that system of change. And we have been able to go from, and I think in our annual report, it did reflect that, we went from spending a couple $100,000 in 2023 to last year spending about just a little over $16,000. So we have minimized the impact of spending a great amount of money when it comes to the hospital line item to being able to really support those that need it when we need to do it, that really don't have insurance. They may not be eligible for Medicaid, but significant impact may come should that change in regards to Medicaid eligibility. And then we look at the economic instability impacting all the aspects of the social determinants of health, education, housing, the food cost, just basic economy. I think it's like a spinning dartboard, and we're not real sure where we're going to land with some of that. And so we're doing what we can to best prepare optimize our resources, and really streamline how we do our work, along with really streamlining our budget, investing where we need to, and investing best in those resources and services that we know can change trajectories. And then we also, here it kind of does talk about that implementation of the case management guidance through that grant with the with the Sioux Falls Area Community Foundation. That's been incredibly impactful. We had the kickoff last October of 2024, and we had 170 plus people attend that event. It was a great opportunity for us to bring together a number of providers in the community, our partners, those that we collaborate with every day, to really have an opportunity to talk about how can we best face tomorrow's together. And in doing that, everybody really supported it. The leadership that's been at all the agencies that have been a part of the planning and strategizing committees. We had our first training, which was the case management guidance training. We ended up with, I think, 123 plus that ended up attending that event. And so it really is about streamlining service, aligning our resources, and supporting one another in what each other does best, and then really staying in that lane and doing what we do it well. And then we know, all of us know those resources, we can support one another, we know where to refer people to. We just strengthen all the resources in doing that. And then lastly, just really quickly before I open it up to questions to all of you, it's usually the same ones of us, if you can just scroll down to the next slide there. That's our team. That's really the heart of what makes it happen. It's nice for us to be able to come to the commission meeting and you see us fairly often. We try not to too regularly. But that's truly the heart of our office. And so we just really wanted to highlight their work, the efforts that they put forward. They're a great team. They do a great job. So with that, I'll just open it up with questions.
We'll start with an opportunity for public comment. And then commission discussion. Questions?
Madam Chair, I can lead us off. I guess I just make the general comment that in this kind of political and fiscal environment, we're all budget hawks now. So I appreciate you and kind of the self-awareness of looking through the different potential budget impacts here and looking for different efficiencies in some of your both highlights from the past, but also wanting to carry that forward. So we appreciate the effort to be as efficient in taxpayer dollars and the assistance we give to folks. I think that the two buckets that I would highlight, and you can sure comment further on them, but I think you had about 5 consecutive years of wins in the rental assistance department. And that's, upwards of maybe $1 million a year that we've had other sources of revenue for, and you highlighted that, but now we've kind of come to an end of that. So that's something we'll look at closely as best we can, but that's something, a service our community relies upon and gets people on that first rung of the housing ladder and on to success, and not draining our services in other ways at homeless shelters and the Link and other places. So that's one area that we'll want to dive deeper on as we go. But then I think the win for you in this 26 budget as we go forward is on the hospitalizations and the Medicaid expansion. And we don't necessarily know the future of that, especially medium to long-term future, but for our 26 budgeting, I think that's probably one of the wins we have to capture, of looking at real expenses here in 25 and tailoring those in 26 to capture some of those savings that I think you just have good allies in the health systems. It's in Avera and Sanford's interest to enroll them in Medicaid rather than sending you a bill. They would much rather get a Medicaid reimbursement. So I think some of the incentives are aligned there, but those are some of the two biggest buckets. And I know your liaison, Commissioner Bleinberg, is probably looking at those elements of your budget as well, but those would be the highlights I have, and just appreciate you looking for efficiencies in all other aspects. But the things that kind of come to the top for me are the rental assistance and the hospitalizations and its correlation to Medicaid public policy that we'll keep an eye on. But appreciate all the work you're doing and your team. You guys make good neighbors for my day job too. You guys are friendly. So thank you.
Well. Yeah, I think certainly in response to that, obviously the rental line item for us is our largest item. We have about 975,000 in that line item. And consistently over the course of the last 5 years, albeit we haven't accessed those funds, we certainly have submitted a budget so that it isn't a forgotten line item, because it certainly is a needed line item. I would forecast that will probably be accessed more than what we probably believe it to be. South Dakota Cares will be coming to a close. The last of the applications will be taken July 11th, I believe. And so with the coming to a close of that, I think we may get visits from a number of individuals who have been accessing that support and now will seek out assistance through us. I think some of the challenges that those individuals will face is that they probably aren't going to meet our eligibility criteria, which is really why we want to try to get on the prevention end of things of how do we best align with other resources so that when those individuals come to our door, we have options for them. When it comes to the hospital line item, I think probably, we are statutorily obligated, right? We have statutes that guide us, along with the guidance that you all approve for us to abide by as well. And I would say that probably this year we'll be able to probably look at cutting about 400,000 out of that line item. We'll probably leave a little residual so that we know we've got a little bit to go on should that change in Medicaid. Hopefully with Medicaid expansion, people are seeking that health care more on an ongoing basis from a clinic rather than resorting to waiting until they are so sick and then up in the EDs. And by then, sometimes things that could have been treated by a simple visit to a clinic are now things that need ongoing treatment and become lifelong issues like diabetes. And so I think we have a lot of great partners. You're absolutely right in that. We have a lot of great partners. I think that all systems are kind of going guns a-blazing here to try to figure out how do we best align resources so that in the end, we optimally take care of our community, but we also are very wise in how we best invest the funds that we do have. Yep.
And I would just like to comment too that both Carrie and Lori have been such an advocate in our community for the county. Our obligation is to be the means of last resort for this population that they serve. And really the people that work on your teams are the boots on the ground in the county's work to deal with that population and to try to provide services for them. And the community collaboration that happens with your staff on the ground is amazing, but then also to see you guys taking that leadership facilitated by that grant from the Sioux Falls Community Foundation to really work with our community partners to build collaboration and just the teamwork and using the same terminology, just aligning with our partners, I think is going to continue to build an investment as we go forward, trying to fulfill our duty to be the means of last resort and also be, conservative with our budget, especially during these years. So one of the things that I really wanted to mention was the Just Home project and how that was grant funded primarily, money that came to the county that through your leadership was able to be used to develop a resource that now we're handing off and not funding with county taxpayer dollars while continuing to provide services to the same group. So just my appreciation and thanks for all that you guys do.
Thank you.
Madam Chair, thank you so much for being here today, Carrie, and I just second the comments of my colleagues. I did want to say, though, I've heard you speak several times in the past at different events in respect to human services and the role of the county. Once, for instance, at the Homelessness Forum, which included Mayor Paul Tenhaken, I think it's really great for the county to be involved in these ongoing discussions with different government entities and other partners that we have. And I think there's some general confusion amongst the public about the role of the county and the Human Services Department and the relationship with the city and how the city is involved in the cooperation and delivery of those services. I was wondering, could you maybe speak about the role of the city and the city of Sioux Falls, in the relationship with the county government?
Sure. I'll speak at least to how it interfaces with my department. I don't know that I can speak for other departments, but I'll sure speak for mine. Our collaboration with the city started a number of years ago. The city had a housing board. We had another board at that time that focused on homelessness. And we started having discussions about why do we have two boards? We have a joint city-county board that you guys meet collaboratively and you discuss issues. So we were like, why can't we do that? And so that really kind of was the kickoff to the city-county from my department's aspect of really saying, how do we better partner here? And how do we collaboratively work together? So the city from my department works on housing development. They're looking at how do we develop housing, build units, those type of things. How do we support that piece? Meanwhile, in the background, we know that what type of housing we need is impacted by the very people that we serve through community or through human services. And so for us, it was really about how do we communicate better so that the development of the appropriate type of housing happens, and we don't forget about those that may be in the lower end of income. How do we not forget about those people? So it really does provide a great avenue by having the AHAB board, which is the Housing Advisory Board. It really is awesome to be able to have that opportunity to collectively work together to look about what is our community comprised of for people that live in our community. What do they need for housing? We can all say that we'd like to see all the different types of housing, but to really make that happen is a different story. And so by collaborating, we do that incredibly well. We have great communication streams, much like the Housing Hub. It offers us the opportunity to offer feedback. That's being fully funded by the city, which is extraordinary, which is phenomenal. But the great part is they don't forget about their partners, and they haven't forgot about us. And so us being able to sit at that table to offer feedback and offer guidance in regards to what that housing hub needs to have, because we're kind of the services end of it, and city is the development part of it when it comes to housing. We do our best to advocate for all people. And so it's really been an opportunity for us to have really great engagement with the city and opportunity to grow. Does that make sense?
Yeah, absolutely.
Answer your question?
Thank you,
Okay.
Carrie.
Okay.
And I just want to follow up with an additional question. Looking forward, are the needs of the community in terms of the need for county welfare assistance increasing significantly or shifting in different ways? I noted that Commissioner Kipley had mentioned $1 million in rental assistance, being a fairly new commissioner and getting up to speed with some of these funding mechanisms. Were those ARPA funds being used for that purpose at the time? Or?
Yep, we did have a portion of the ARPA funds, and those were dollars that were allotted by you all. It wasn't our vote, and it was fine. It worked out incredibly well. It's just it wasn't that it didn't work well. It worked well. It was a great way to utilize the ARPA funds. Our challenge is just that for us to look back now, we don't really have a good measure of the who, the why, those type of things. It isn't quite as measurable. I will say that I think that the needs of the community have shifted a bit, and I think much of that is just economy as a whole. When you look at the cost of apartments in Sioux Falls, it is incredibly difficult for us to find affordable housing for individuals that cross the threshold of our door. On an average, a one-bedroom apartment is between $600 and $700 on the low end. And that's a stretch for some people. And so it's just for us to be incredibly mindful of how do we continue to have the conversations, be advocates for that populace so that they're not forgotten and builds can continue to happen, but we also need to be mindful of those that are on that lower end. I think needs will be ever evolving. When I listen to Tom and Aaron about the mental health significant issues that have been present in our community for a long time, I think really they were impacted by COVID. And I think as a community, we just need to, like the mayor's challenge, those 100 workouts in 100 days. It doesn't mean you have to go to a gym, but getting out and getting people involved in our community so that people are healthy. I think that's been a forgotten element for a really long time. So as our community evolves, so does the need for our budget to be flexible. And certainly our rental line item, I think when people hear 975,000, it sounds like a lot of money. When you start helping people pay the size of rents that are in Sioux Falls, that's not a lot of money. It goes incredibly quickly. So I would give 100% of that credit to the crew you see on the board. They do a great job of working with people to screen out those that have the high need. We help where we can, but we also want to empower and do a good job of referring them out to other agency resources, because we know if they access those other resources, that means that they don't have a lien with the county. And so all we can do to better support our other resources, provide opportunity for those that we serve, meanwhile not creating a lien for them. So,
Thank you.
Thank you.
yep, thanks.
That brings us to item 13, briefing to discuss highway revenue and wheel tax. Jacob Morris, Highway Superintendent. Good morning.
Good morning, Commission. Jacob Mars, Highway Superintendent. I have before you today to discuss revenue and wheel tax. The last time our wheel tax was raised was in 1995. It was originally enacted in 1991 at $2 a wheel for $8 total. 95, we moved it up $4 a wheel, $16 total. And which was the maximum allowed by state law at the time in 1995. In 2015, state law changed to allow a maximum of $5 a wheel, up to 12 wheels for $60 total. And just to give a little perspective versus the taxes we're asking for versus what it actually costs to go out and maintain the roads. In 95, it cost $16.15 a ton to purchase a ton of asphalt, and 2025 we were at $67 a ton. So costs have gone up quite significantly in that time frame. And then on the left side, there's also a graphic showing what our neighbors are using for wheel tax as well. The only county adjacent to us that's not maxed out is McCook County at $5.20 total. And these counties also use general funds to fund their highway departments as well, where Minnehaha County is rare in the state where we don't use general funds to fund our highway department. It's strictly user fees, from license plate fees to wheel tax to gas tax. Those are kind of our funding sources. Our revenue over the last 10 years, I don't know if this will all fit on there. There we go. So from 2015 to what we predict to end 2025 in, our revenue has gone up at 2% per year. And to put in perspective, our cost of construction, when we hire out a contractor and do a mill and overlay project, which generally our mill and overlays are mill off 2 inches, put 2 inches back on. Those costs are generally about 50% labor, equipment hours, and 50% materials. That has gone up 16% in that same time frame. So it's getting more and more expensive to maintain the roads with the same dollars that we have. In addition, when we're comparing Minnehaha County to the rest of the state, we have 347 miles, 2 of which are gravel. We have 10 miles of concrete, and the remainder is asphalt roadways. We're the only county in the state that only has 2 miles of gravel, and we actually are in a contract with McCook to maintain that for us because we just don't have the expertise to maintain gravel. So we get a pretty good deal from our partner next door. This graph was a little bit more confusing. So we do a pavement management study every 3 years to look at where our road conditions are. So the last time we did this study was in 2023, and our pavement index was a 75.3. These lines show the different amounts of money down here, if we were to spend $2 million a year, at the end of 5 years, we would be at a 66.9. $3 million a year is the next line up. To maintain where we're at today would cost approximately $4.4 million, $22 million. This breaks it down by project and per year. The numbers fluctuate because this graph is actually built off of actual projects. That would maintain us at a 75.4. Our road condition, I feel, is reasonable where we have. The roads aren't too nice, but they're not too terrible. There are some really good roads, and there are some roads that are quite poor, but that you're going to have that throughout the system. What the graph doesn't show is this lane length deficiency percentage. In 2023, we were 4.5% deficient. We have roughly 700 lane miles, so you double your mileage to just run it up per lane. In 2028, it shows that we would have 27.9% deficient lane miles. A deficient lane or deficient roadway would be where the average person feels that road isn't meeting their criteria of what a good road could be. That changes based on the level of service of that roadway. A rural road is going to be a lower score than an urban collector that gets 10,000 cars a day. That's going to need to have a higher score to meet that minimum criteria versus a road maybe in the northeast part of the county that sees 200 to 300 cars a day is going to be lower. But on average, that would be the general consent of the public that our road condition over time will go down based on our pavement management suggestions that we have. This came out in 2023. We are implementing next year for the first time increasing our budget $1 million a year to offset this study and add $1 million into our budget without any additional revenue for that. So to make up that $1 million, there are projects like full reconstructions. This is County Highway 149 south of Colton, where we, over the last 2 years, this is the third year. Last year, we rebuilt the inslopes, widened the shoulders. The year before that, we put new culverts and bridges under this roadway. The next couple of projects that we have are County Highway 103 and County Highway 105, which are in really poor condition. The amount of work that goes into building out the dirt work on the roads is about 100% of the cost of the surfacing. So say a road costs $1 million a mile to resurface, it also costs about $1 million a mile to grade. So the next few projects we have, the surfacing is in poor condition, but just adding more surface on top of that makes that road that much more unsafe. So my plan is to reconstruct those couple of roadways, and without increasing the budget, we'll still do those projects. They just get pushed further down the road, timeline-wise. Looking at our 5-year plan, we put together a 5-year plan every year in support of our big grant applications, so we know and plan for construction projects from 26 to 2030. This shows a couple of different funding options. The green is our revenue and the blue is our expenditures. A couple of years we really go a lot higher in revenue expenses, and that is due to grant funding. Grant funding that we have matches for, and we get reimbursed for a portion of it at the end of the year, but that's why these 2 years are uniquely high. So this, with our current 5-year plan, we end up negative $2 million in 2030, adding a wheel tax where we just increase taxes to those vehicles above 6,000 pounds. This graph shows us about $700,000 short in 2030. I recently got, Friday, I got new numbers back from the state. That shows instead of getting $300,000 a year for that scenario where we raise the wheel tax $1 for those over 6,000, we actually generate around $200,000. So this would be about another $500,000 negative. I can't read that number, 693. It would be about another $500,000 negative. That's because our estimate that we were working off of was based on estimated average number of wheels in the county, whereas the majority of the vehicles in the county have 4 wheels. That's over 90% of the cars are 4-wheeled vehicles. So increasing the wheel tax, we really see a big positive to our budget if we increase it starting from the bottom up. That's what this top line shows. It shows us ending year 2030 at about $3.1 million. The highway department likes to keep somewhere around $3.5 million as the bottom line reserve number, just in case there's an emergency situation where, say, a bridge goes out over the Big Sioux River. That's about the cost of what that would be. Their year 2029, this graph doesn't show it, but I have a Maple Park Street grant project, which is in the budget for that year. It's just shown right now as a grant with no input dollars from the highway fund, just because I'm not sure what year that project's gonna fall into. And if the wheel tax isn't increased, there is an option to apply a property tax levy for use in federal aid projects. It can only be used if it's going in support of a federal aid project. But that would be an option if we needed funding at that time to fund a grant such as that. And I just like to end with, when it comes to cost cutting, a lot of people like to compare, well, how much do you spend a day on coffee? And an average order at Starbucks is going to cost you more than $4. So in this scenario, you couldn't even purchase a coffee for the tax revenue we're asking just to go out and keep our roads in good condition. That's all I got. If you guys got questions.
We'll start with public comment. Is there anyone from the public that would like to comment on this? Commission, open it up to discussion.
Madam Chair, I can lead us off. Appreciate this information. I think one of the key themes is the keeping the wall of separation that you modeled between the general fund and the highway fund. And I think it's fiscally responsible of you to come before us staying in your lane, pardon the pun, I guess, but staying in your lane of, we take use taxes, the people that use the roads that then need to be repaired, and that keeps a correlation in our taxing mechanism, so that the people that are using the roads are paying the tax for that. If we started to say, and I know some other counties out of just necessity have to do it that way, but if we got a good thing going in Minnehaha County, let's keep it that way. So trying to not come forward with a plan that then would have to dip into property tax revenues and general funds. So I think you're on the right track there. If I could ask Trish to, if we can get up to the first slide with our other sister counties, because I think this makes the case. A couple key points here that maybe I can phrase it as a question that you can confirm this for me, Jacob. But right there, I know the state is bigger than this 6-county area, but if we're competing for big grants with these 5 other counties, we're at a strategic disadvantage because we're the only one not at a $5 wheel tax, and so we don't get all of the points for a big tax. Is that correct?
Yes, I failed to mention that. Another point for a big program, the big score is a big long formula, but at the end of the day, if you have $5 a wheel tax, it allows you 2 additional points towards your big score And we've missed out on grants in the past by less than 2 points. We've been close enough to the bottom score by less than 2 points where we may have been awarded funding had we had 2 extra points that year.
So I think this slide is compelling for that reason and our sister neighboring counties, and then also I appreciate the history. That was one of my questions for you, was just on all these fees that we get asked to increase fees for the use of something, whether it's down in Registry of Deeds office or anything. We have to keep up with inflation, and when this has a history going back to 1995, and then we in theory could have raised it in 2015. But we chose not to. But obviously, in that whole time period, your input cost has been going up. So I think we're going to have to give some strong consideration to this. I know this is just a briefing today, but I think when we look at this context and we're looking at our budget and wanting to protect that wall of separation of not needing general funds in some future state, I think we probably need to invest in this revenue stream in the next year. And match some of our sister counties at that level. So you've got my support on that, and appreciate the information today.
Madam Chair, thank you for your presentation, Jacob. Very informative. I did reach out to the public just to get a sense of sentiment across the board. I sent out both an email and posted on social media to solicit feedback in regards to the possible increase in the wheel tax. Now, while admittedly this might not be exactly representative of the public as a whole, it at least provides some context and more or less tracks with my anecdotal experience conversing with various individuals at events and with friends. In response to my solicitation for feedback, roughly speaking, approximately 20% said they wanted no increase of the wheel tax whatsoever. Approximately 40% said they would be supportive of an increase on the heavier vehicles, which do significantly higher impact to the road and more damage. And then the rest, 40%, reported being okay with an increase of the wheel tax across the board, assuming, of course, the county truly and justifiably required the additional revenue to keep the roads in good working order. Now, I think we can all understand that road maintenance is a basic responsibility of government, being that it's truly a public good, one we use on a regular basis. However, it almost goes without saying, but in this case, worth bringing up, that the government should only tax what is necessary and be good stewards of the taxpayer monies. And as a general philosophy, I believe it's beholden on government to justify its expenditures and have the general consent of the govern. So in that light, how would you reply to those individuals, say that 20%, who don't want any increases, or those 40% that want limited increases, which I think, per this presentation will put us in the in the red down the road in a few years. And maybe you could elaborate on the potential consequences to the state of the roads if we forgo projects in respect to increasing the damage of the roads over time, wear and tear, and therefore costs. Would the public be worse served if we don't increase the fee in some capacity or across the board?
So I like to compare road maintenance to vehicle maintenance. It just seems to make sense. So the spending $2 or $3 million a year, it's essentially like doing a longer interval on an oil change on your car. Yeah, you're going to keep your car running, but the engine's going to quit sooner on you at the end of the day, and you're going to require a new car quicker than you would had you done the maintenance that was required or a higher level of maintenance. You can keep that car running longer. And when we get to the end of a pavement's life, the cost is very significant in order to replace that entire roadway. I would suggest we post our 5-year plan online on our county highway webpage, and then every fall we hold a public meeting where we go through our 5-year plan. And I would encourage the public to come visit, come check out that 5-year plan, and then go see what out in the field what we're actually going to go out and work on. Why these roads need to be reconstructed, what kind of condition they're in. I feel a fair number of complaints throughout the county of people that aren't satisfied with a specific section of road, and those show up on our pavement management survey as poor condition roads. So I would just say it's an effort of making sure that we're doing the proper maintenance for our roadways.
Yeah, I think further is something to be said that we're one of the few counties, as I understand, that doesn't levy property taxes to pay for their roads, using entirely user fees, to keep them maintained. If we don't raise the wheel tax, do you foresee property taxes needed to be levied to maintain the state of our roads?
If you wanted to maintain the roads in their current state, yes. If there was no additional general fund dollars at this time, we would just push our reconstruction projects further down the road, and wait a longer period of time in between doing the reconstruction projects. We just have to save before we spent that money. It would create a longer interval in between projects, which would just like the oil change scenario where you're not keeping up with the maintenance you should be doing.
Okay. I did want to bring up one figure here, and I'm getting this from the Green Book, a book of county facts, first edition, year 2025, put out by the South Dakota Counties Association. It appears to me that Minnehaha, the highway expenditures per capita in 2023 were $85.22 dollars per person. But if you look at, say, Sully County, that number increases to $2,500. So it appears to me we're fairly good stewards of the taxpayer dollars here and are getting more bang for a buck, as it were. Even if we look at an adjacent county, say Moody County, at $444 per capita. I'm just, as a layperson, looking at these numbers, what's a good explanation for these huge variances and the cost of roads? Does it come down to the size of the population or the size of the department, or?
So there's a lot of variables there. In Minnehaha County, not all of our roads that we have in Minnehaha County are county roads. There's a fair number of state roads. There's a huge number of city roads within Minnehaha County. So that would drive that number down. In addition, in the more rural counties, those are all gravel roadways, which there may be a spike here or there as maintenance is required or structures need to be replaced. There's a lot of variables that go into that number, but it's really going to be diluted by the population that we have in Minnehaha County.
Right. And one last question. I know maintaining a highway fund, something in reserves of, say, like you mentioned before, a bridge goes out over the Sioux River, or a roadway gets washed out in a storm or a flood. What impact would maintaining the current fee structure do to our reserves over time?
Yeah, and the last slide here showing expenditures and revenues, I think, really tells that story pretty well. Based on our 5-year project plan that we have put together, we end up negative, but with the $5 per wheel for everyone, we end up around $3 million. Like I stated before, replacing a bridge on the Big Sioux River, which could be lost in a big storm per se. In 2015, we about lost one in Baltic, but around that $3.5 million is what we're looking at to replace a structure of that size.
Yeah. Thank you, Jacob.
Mm-hmm.
Thank you for all of this work that you've put into it, and many of my comments have already been stated, so I will keep it brief, but which is probably surprising because I've asked a lot of questions about this to you and your predecessor. I appreciate all your responses, And as much as I would love to, not raise any user fees, every time I come back with a question, well, what about this? What about that? How can we avoid moving forward? I think I'm just coming to the point where this is unavoidable due to the number of projects that we have, the size of the projects, the increased costs, and the use that all of these vehicles get in our roads, that our roads see. So thank you for all the work that you've put into it. And this was just a discussion, so no action.
Madam Chair, can I just ask one more question? Was just on that graph that shows the pavement preservation when do we do another one of those studies that we'll get an updated version of this to see if we're still on track?
Next year. We'll do
Next
one
year.
in 2026. So we'll do the study hopefully spring, middle of summer. We won't see the results till late fall or maybe after the first of the year.
Okay, thank you.
Yep.
Thank you.
Could I ask a follow-up question about that? If I remember correctly, we don't do all of the roads, is that right?
We do, yes, we do all of our roads in Minnehaha, we do all of the county roads except for the 2 miles of gravel.
Okay, they're all included in the
They are.
score.
Generally, we do that project in conjunction with the MPO, and the MPO pays for a portion of that study. They only pay for the roads that are within the MPO. The ones outside of the MPO are fully funded. The study is fully funded by the county.
Thank you. Okay. Moving on to the next agenda item, consider a motion to authorize the Highway Department to purchase up to $130,000 of metal culverts from Beadle County's metal culvert bid. Jacob Morris.
Thank you, Commissioners. Jacob Mars Highway. We generally purchase off Beadle County's bid every year. True North Steel is located in Huron, which is the county seat of Beadle, and they put out a bid for culverts every year and get very good prices. So we are requesting to purchase off that bid. Generally, the culverts we buy on that bid go in support of the townships in Minnehaha County. We have $50,000 set aside every year for assisting townships with replacing culverts. Due to the number of requests that I've received in the last 2 years, I would like to spend the money that we received back last year from FEMA. We assisted Wellington Township and Clear Lake Township with replacing a couple of culverts, and they reimbursed us when they got paid back from FEMA. So in addition to the $50,000, I'd also like to spend towards the townships an additional $40,000 from Wellington and $24,000 from Clear Lake on the townships.
Okay, any public comment on this item? Commission? Discussion or motion?
I'll make a motion to approve.
Motion and a second. Roll call vote, please.
Kipley.
Aye.
Heisey. Blyenberg.
Aye. Motion carries. Thank you. That brings us to Commission Office Annual Presentation. Tom Greco, Commission Administrative Officer.
All right, good morning. Tom Greco, Commission Administrative Officer. Just going to provide an update, our annual update from the office. Starting with this first slide, just basically what the office does. Our primary goal is to support you, the Minnehaha County Board of Commissioners. We play a role in implementing and sharing the implementation of policies, programs, and procedures, large role in collaborating with others, other departments, other stakeholders, other organizations, so on and so forth, and also advising on matters that will ultimately come up for commission consideration. The office itself is a small one. There are 4 of us, myself, and then, of course, Meredith, the Assistant Commission Administrative Officer. Sandy Kinder came on board last fall as the Commission Assistant, and, of course, Joel back in the control room there, making sure that our meetings are broadcast live and made available to the public. I listed under here, and I'm not going to go through them, the various things that we do per person within the office, but I think the key takeaway is that we have a pretty wide and varied role in terms of the things that we accomplish on a daily basis. But one of our primary goals is to make sure that we help sustain the strategic vision of the commission, and again make sure that the will of the commission is carried out on a regular basis. So what that actually looks like, I took 2024 here and just kind of included it as a snapshot. Some of the things that are a little more visible, certainly commission meetings, a little over 60 of them each year. And of course, that's supported by the auditor's office, Kim in particular there, 600 agenda items. So there's a wide range of things that you all are considering. Sandy does a great job putting those agendas together to make sure that you all have the information that you need to make important decisions. We're also playing a role in managing about 60 commissioner liaison assignments. So that's everything from department head liaison assignments to outside agency liaison assignments, and then other various boards and commissions that the commission sits on. So a wide range of contacts with the local community out there and certainly stakeholder organizations. And then, of course, budget planning and preparation. So in coordination, certainly with the auditor's office, it's our goal each year to put together a sensible budget preparation plan. You'll start seeing that certainly later on this month come to fruition with budget meetings kicking off next month. In terms of implementing policies and programs, one of our key efforts this year and the year prior and next year is the Juvenile Justice Center construction project. So this year in 2024 alone, we saw $13 million expended on that project. Obviously a huge investment by the county. We are under budget already from the original budget of $50 million that was set last year, currently operating at about a $47 million budget. In 2024 as well, we managed a $147,000 MacArthur grant funding. This past year, you did see, obviously, the latest grant come to a conclusion. We did have excess funds with that, and in coordination with other stakeholder organizations, we were able to provide some money to the link to support some additional staff over there to move their strategic vision forward, and again, all in line with the goals of the Safety and Justice Challenge. And then just one little tidbit there. From a financial management side, the commission office, the commission budget is typically less than $1 million per year. But we do manage a wide range of invoices that cover a lot of other, I'll just say, organizations within the county. So we, in 2024, we saw about $14.5 million worth of invoices come through our office. And that's everything. A large proportion of it is certainly the Juvenile Justice Center project, but also managing the invoices for all of our partner agencies, the outside organizations, and various other contracts that we manage. So large volume of work coming in and out of the commission office. With that in mind, we do manage about 40 contracts and agreements, which is a large number of contracts and agreements. And again, those range everything from professional services agreements to our standing annual agreements that we have with other organizations such as the Humane Society. That's a task that we split among the three of us, myself, Meredith, and Sandy. And of course, we do our best to make sure that we're managing the funds that the commission has allocated to these organizations. And also just keeping a tab on the 24 internal and external boards that you all are members of. So just want to, and it probably goes without saying to you because you're the ones doing it, but you all put a tremendous amount of work in outside of this 9 a.m. meeting every month. And I, certainly want to make sure that doesn't go unnoticed, but it is a huge investment in time, but it's also a great way, obviously, to connect with partner organizations. The Juvenile Justice Collaborative, our office does have the lead on that. It's a collaborative of various entities throughout the county to include several departments, and also the Safety and Justice Challenge. Both of those efforts are really aimed at safely managing the populations in secure detention, either at the jail or at the juvenile detention center. And then the last thing, just on a routine basis, we're working on ordinances and policy reviews and revisions, trying to make sure that we're adapting to legislative changes, so on and so forth. But also just legislative bill tracking. Meredith did a great job with that this past spring, and the work continues because there are some follow-on items from the legislative session that we'll keep an eye on over the coming months and years, certainly. And then, of course, one other thing that I just like to highlight, because it is a huge investment by the commission, but also a way that we reduce our risk as a county. I did list on here property and liability insurance review. A lot of effort put into that this past year. Work closely with our agent and carrier to make sure that we got the most value for the county while also protecting the over 80 facilities that we have as an organization. So just trying to be proactive in those areas and making sure that we're being good stewards, obviously, of taxpayer dollars. So this year, our focus areas have really been on campus master planning. Meredith and Mark Krenz doing a great job with that. You will likely see a recommendation for a contract award within the next month. But that's really a huge effort by the county to invest in and identify what the long-term needs are going to be. And that's really going to set the county up for its strategic vision in the coming decades. Just a reminder, RFP was issued March 4th, and they are going through the evaluation process. The other piece that I noted before, a large investment by the county in our Juvenile Justice Center. Project is coming along very well. I will say that the project timeline has slipped about 2 months. We were originally, for phase one, we were originally looking at a completion of mid-August of this year for phase one, but it's looking more like that's going to be in October. However, we still are staying on track with the final completion of the project, which is still in fall, winter of 2026. But this Juvenile Justice Center project has really been a great example of collaboration among multiple stakeholders, not just from schematic design and conceptual development, but up to the on-the-ground construction process every single day. And then, of course, the annual budget. One of our major focus areas is putting together and making sure that we are able to provide you, the commission, and the public with the information you need to make decisions on the FY26 budget in this case. You'll start seeing those meetings next month. Some of the things that we'll be talking about and possibly even coming to you beforehand are some of the legislative changes that came out of this past session. The biggest one of which, and has garnered the most attention, is SB 216 regarding property taxes. So it'll be our job to make sure that we share what the implications of that legislation is, but just within the regular course of budgeting and putting that product together for you, making sure that you have the information that you need, again, to make smart decisions. And then lastly, just the ARPA funds obligation by the end of, we're obligated by the end of this past year. Again, a focus area that the commission had several years ago when ARPA funds were awarded. The goal was to use them in a smart way and avoid a financial cliff in 2025 or 2026. And I think you can say that you certainly did that through the wise management of ARPA funds. And then looking out to 2026, we'll continue with campus master planning, finishing it up, but also starting the conversation with the commission about how to actually implement the recommendations that come out of it. Juvenile Justice Center construction, again, will be ongoing. Our goal will be to make sure that that stays on budget and on time. Conclusion of Martin MacArthur grant funding. So the county has received close to $1 million worth of MacArthur grant funding over the past several years. That will be ending in 2026. So it'll be important that we have a transition plan and we're able to cover down on those programs and policies within the grant that work for the county and make sense. And of course, planning for the FY27 and also just implementing the FY26 budget. Those will be the major things that we're looking at next year. And so with that, just a short overview of the commission office, and I'll open it up to any questions if you have any.
Any public comment on this item? Commission discussion? I could start us off just by saying thank you for the presentation and the concise summary of the scope of so many things that your office manages. I can't imagine trying to do this job without your assistance, so very, very much appreciated.
Yeah, Madam Chair, I'll just echo that. I know a lot of the department heads look to your office for leadership and to kind of herd the cats, so I'll just appreciate everybody in your office, Tom, Meredith, and on down the line. And you heard the five of us cats pretty well too. So thank you.
All right, thank you.
That brings us to an opportunity for public comment. Seeing none, moving on to, oh, yes.
I would just comment from the Siouxland Renaissance Association.
Would you mind stepping up, and if you could introduce yourself for us?
I am Anna Voorhees, present chair of the Siouxland Renaissance Association, and I didn't realize you have become more efficient. Previously, arriving by 9:15 would allow me to speak, and I missed my opportunity. Hopefully, you have approved our submission of an alcohol license that we may party in true Renaissance fashion with mead and wine and beer at our fair the 7th and 8th of June, and I cordially invite all of you to come and join with us.
Thank you. Sorry that we moved along too quickly this morning.
It was my fault. You were scheduled at 9, and I tell time by Renaissance hourglasses.
That brings us to commission liaison reports. Anything?
I've got one, Madam Chair, just to give us a heads up, and I'll reach out to Commissioners Benninga and Karski as well as needed. We had planning and zoning on Monday night, and I think Commissioner Heisey was actually there for at least this portion, but we had kind of a quirky issue out of Del Rapids. So the joint meeting with Del Rapids had a issue of non-agreement between the County Planning Commission and the Del Rapids City Planning Commission over an item in the joint jurisdiction, and it was for a temporary use permit for an asphalt plant inside quarry land, and I think we're on the right track with it, but there was some confusion, and we didn't have the right person from the applicant's company to define for us their measures going on for controlling certain odor emission, essentially. So that will actually get automatically appealed up to the joint body of the Del Rapids City Council and us as the County Commission. So I think we'll see that on May 20th. And I've talked with Sheldon Jensen from City of Del Rapids planning world, and Scott Anderson, Kevin Hoekman from our planning world. I think we'll have it ironed out to just make sure we know what we're talking about and what conditions need to be on that temporary use permit. So we'll see that on May 20th. But I think that's all I have, Madam Chair. Thank you.
Thank you.
Madam Chair, construction at the museum, Courthouse Museum that is going well. I just wanted to note that the 6th Street side of the road is closed for the time being. In the meantime, I've also been meeting with department liaison assignments, going over their tentative budgets, and I think we're going to come in pretty conservative for this next year. I was able to attend an online Zoom meeting with county treasurers and commissioners from across the state in regard to the issues that the treasurer's office has been having with Drive 605, and there's quite a number of frustrations expressed. So it's not something that's unique to just our county, but all across the state. And hopefully over time, those kinks and issues will be worked out, and people have a more efficient service downstairs. So that's it. Thank you.
Thank you. I was just looking at my calendar. I think since the last meeting, we had a city-county school meeting, unless I highlighted that last time. And Jamie Gravitt from the Juvenile Detention Center spoke and did a great job of giving an overview of the history of the JDC, but then also the current need with the juveniles that we house and for the building project. Just did a really great job of giving an overview of all of the aspects of caring for our juveniles. I also had the opportunity to visit the Glory House, which is one of my new liaison assignments this year. Nikki and Kelly especially were great and took a lot of time to help me understand all the aspects of what they've got going on. The last time I was there was for the ribbon cutting when they opened the new apartments. And so on my most recent visit, Kelly took me through the older portions, and Nikki did a great job of painting a picture of the needs as they foresee them in the future, and some ideas and collaboration that they're looking for in the future. And then next Tuesday, I believe, is the Sioux Metro Growth Alliance bus tour, which is an annual event that we look forward to attending. They do a great job of showcasing the development in the county, in our various communities that are within the county. And that's all I have. Non-action commission discussion?
Madam Chair, just take the moment because Tom ran away from the dais too quickly and didn't get to spit out what I was going to say. But I did want to mention that I am very thankful for the commission office staff for their regular updates, help, support, logistics as we do our duties and serve the public good as commissioners. Really couldn't do our jobs without all the behind the scenes legwork and diligent planning. I know Sandy's not in town this week, but perhaps she's watching this morning. But just want to thank all of you for your help and your guidance and wise advice. So thank you.
That brings us to the end of this meeting. Executive session will be immediately following the commission meeting for the purposes of SDCL 125-2, 1, 3, 4, and 6. Looking for a motion to enter executive session.
So moved.
Motion and a second. Voice vote. All those in favor, say aye.
Aye.
Opposed, same sign. Motion carries. Thank you.